Good morning, everybody. According to the official timekeeping system of the United States of America, my Verizon cell phone not paid off. It's exactly 10 o'clock Eastern, 9 o'clock Central, 8 o'clock Mountain, 7 o'clock Pacific. And of course, if you tuning in from the great states of Hawaii or Alaska, I bet you it's a wee bit early in the morning there. Thanks so much for joining me today. It will be us sometime soon. As you can see, Jim Blair's not on this open forum yet. He's driving home from doing a consultation, not a consultation. He had a workshop to give, and he thought he'd be back by 10, and so he's not. So he said he should be back somewheres between within 10 minutes. So we'll see how things go. First of all, I want to reach out to Teresa. Sorry about the Steelers not winning on Thursday. Who are you rooting for tonight?
I don't know.
Well, isn't Baltimore playing?
Well, I won't ever vote for Baltimore, ever.
Okay. Just say whoever they're playing, you're rooting for them, whomever it is.
Exactly.
Okay, that's fine.
That way we get to stay a game in front.
Yeah, a game. Okay, game. Okay. So anyway, you know the rule. If you like to run to the top of the thing, feel free to. I might just have to move your question to when Jim Blair will be here. Okay. And that will be in about 5 to 8 minutes or something like that. So if you'd like to run to the top, go for it. If not, I'll just go through the NSSA squares and see how well we do there. So, Philip, you're first.
Morning, everyone.
You're a little light, Philip.
Oh, you hear me okay? Hello?
We
Hello?
can hear you, but it's a little light. But go ahead.
Yeah, I actually have a question.
Uh-oh. Where's Jim? Go ahead.
Just give me 1 second. I'm going to see if I have a better microphone here.
Yeah, I can hear you okay now.
Oh, okay. I have a client who has applied for the Social Security benefit like in late 2022. So she doesn't receive her benefit until earlier this year. So I was
Wait a second. 2022?
correct, yes.
She doesn't receive what until this year?
The Social Security benefit until earlier this year.
Okay, but okay, go ahead. But she applied last year, so that's why I'm 2 years ago.
Yeah. So I was wondering, is she going to be able to get the benefit, for 2023 and all, or those will be just gone forever?
Well, I don't understand. Why did she apply in 2022, and why wasn't she receiving a benefit at that point?
Oh, her story was she went to the Social Security office, okay, and then that person took care of her, retired, so her file was remain open, and then nobody worked on that, and then all in the sudden, in earlier this year, she started receiving the benefit.
I I have no clue as to what's going on, Philip. Let's save that question for Jim. Unless you have some additional facts as to why it was kept open for 2 years, I don't
Right.
know if Jim would even have an answer for you.
Okay.
Sorry, but why don't we save it for Jim? I want to go to Shay. Shay sent me an email earlier today about weapon GPO. I know I can answer a weapon GPO question. So Shay, go ahead and unmute yourself and go ahead and ask your question, please. I want to go with you. There you
Hey,
go.
good morning, Mark.
Hi, Shay. Thanks for joining us.
Yes, sir. Yes, sir. My question this morning, I'm a little confused on. Let me just kind of rephrase that again. Is the eligibility for someone to receive a Social Security benefit? everything I'm kind of seeing states that a person must have their 10 years or 40 quarters, to be
Okay.
eligible for a benefit. However, I was a little confused on that because I think one of the illustrations we had listed a gentleman by the name of Tom that did not have any years of substantial earnings, but was showing the
So
WEP illustration there.
is this a Social Security eligibility question or a WEP question?
Um,
So tell me about Tom. Was he a public worker?
yes, had a
Okay.
non-covered earnings.
Okay. Did he have any earnings and credits for Social Security benefits?
Well, that was kind of my follow-up.
Okay.
The slide that was referenced in the on-demand video stated that he did not have any years of covered earnings.
Okay. Then he'd only be eligible for benefit off of a spouse in that case.
Okay.
If he's not eligible for anything off his own work record, WEP won't be an issue. But if he wants to claim something off of his spouse, then GPO, Grumpy Partner Offset, will be an issue. So you reduce what he can get off of a spouse by 2/3 of his state pension, and if anything is remaining, he'll get it.
Got you. Okay. But as far as WEP goes, he has to have earned that time to be able to receive that Social Security benefit.
Well, he needs to have 40 credits.
Right. Okay.
Pure and
Gotcha.
simple. Yeah, if he has 40 credits, then he's eligible for his own benefits, and WEP will apply, reducing his own benefit by as much as, I'm going to guess, $580 or something like that in 2024, and $613 or so in 2025.
Got you. Okay. All right. Well, I appreciate that. That clarifies what I was inquiring about.
Okay, great, Shay. Thank you.
Thank you.
Teresa, I'll go to you, Teresa.
No questions for me today.
Okay. Susan, hello, Susan. Now, don't forget, Jim's not here now, so got to take it easy on me.
Is that
Well,
me?
good morning. I do not have any questions for today.
Oh, that's pretty easy on me. Thank you so much.
Sue does.
Okay, Sue, I was going down my list. Go ahead, Sue.
Okay, very good. Sue and Susan, one and the same. Okay. Spouse Tammy, 66, Rich, 63. He's the major breadwinner. Okay. And she's had a job change, so lower income, and she's inching to retire. So I know with this living spouse in an existing marriage, it's not as beneficial as a, say, widow or divorced with flexibility. So,
Well, no.
well,
Divorce and current spouse would be the same. Surviving spouse is different.
okay. Then if she turns on hers, okay, she'll be at full retirement age, 66, or soon to be 67, excuse me.
Okay.
And if he's still working, can he get half of hers?
Well, the spousal benefit rules mean that once the higher income earner applies, the lower earning spouse can also apply for a spousal benefit, might be the spousal boost. And as long as the lower earning spouse is at least 862.
Okay, so in other words,
Mark, it sounds
What-
like it's the opposite though here.
Well, I'm saying lower earning spouse versus higher earning spouse. So what I'm saying is for the lower earning spouse to receive off the higher earning spouse must be receiving a benefit.
okay. But in this case, as Chris
Okay.
said, it's, like reversed. Is there any strategy that you see that could benefit them so that when he does reach full retirement age, if he, you said the key word, the higher income individual. Okay.
Yeah. Okay.
Okay. So Social Security will know has the higher income, correct?
Yeah. They'll pull up the earnings record from both individuals.
So when she turns hers on, then really he can't get a spousal benefit then, can he?
You see the lower earning spouse or the higher earning spouse?
He's a higher.
Okay, so when she turned, no, I don't think a spousal benefit would be eligible for him if half of his PIA is greater than her PIA, which I assume it is.
Okay, then strategically, if there's only about maybe 3 years between them, there's no way of her getting higher unless she turns hers off at age 69, gets an 8% increase because he's now collecting his down the road at full retirement age, correct?
Well, for her to collect off him, she's the lower earning person, right?
Yep.
He needs to turn his benefits on. So if she turns her benefits on before she reaches her full retirement age, or even at full retirement age, she won't be eligible for a spousal benefit boost off his record until he turns his benefits on.
Okay. But because she's full retirement age,
Okay.
if he becomes full retirement age and she's not yet 70, she could stop hers then, correct?
What do you mean by a voluntary suspension you're talking about?
Yeah, to get an 8% increase if that's still around with Congress.
Yeah. However, though, if she gets delayed retirement credits, that will reduce what she can get as a spousal boost.
Okay.
So it doesn't make sense for lower earning spouses to wait beyond their full retirement age because every increase for DRCs reduces the spousal boost they get off their spouse.
Okay. Okay. So she could turn hers on at full retirement age. And then when he becomes full retirement age, if he's is considerably higher, would they consider her for a spousal boost automatically?
No, he needs to turn his benefits on, and then she needs to file for the spousal boost.
Okay, so because she turns it on first, she's going to get her full retirement age, full retirement income. He then a few years later becomes full retirement age, turns his on, and therefore she now can apply for a spousal boost based on his, correct?
Yeah, she must apply for it. Correct. Yeah.
Okay, she must apply. Okay.
Yeah.
Okie dokie. Thank you.
Okay. Thanks, Sue. Appreciate it.
Yeah, thank you.
Okay. Chris, you're up, Chris.
So my question was really, I was not able to make the call on Friday. So here,
I don't want to handle the restructuring questions on this open forum.
okay, fair
Okay,
enough. So
if
let's go to the question that was presented before, and you jumped at the opportunity to explain in a simplified fashion a weapon GPO or
Mhm.
GOP. Government GPO. So in your mind, just in a fifth grade level fashion, if somebody is WEP, windfall election period, I took your notes in saying, hey, they're a federal employee or municipal. Somehow
Mhm.
so in my mind, they were a governmental employee that did not have Social Security withholdings to some degree withheld, therefore are not eligible for as much. Is that a correct statement?
Well, they did not have FICA taxes withheld from their salary
Okay.
as a government employee, then WEP or GPO will apply.
Now the GPO, which you call grumpy partner offset. So the reason it started to ring a bell with me is so that would affect the spouse of a government employee.
Yeah.
How?
Well, it won't affect the spouse of the government employee.
But
It
why is the
affects
spouse grumpy then? Why are you calling him grumpy?
no. Well, the worker. Here comes Jim. Good. So the worker. So the worker is, let's say, the wife. So she's eligible for her own public employee pension, and then when computing the benefits she gets off of her spouse, then you reduce that amount by 2/3 of that spousal benefit.
So I got you.
So,
So
yeah.
it's the worker is based on because of the spouse and is why it's a grumpy partner. I was just trying to figure out where you came up with the
there are two spouses here, but the only spouse that it affects is the spouse that's receiving the government pension.
I got it. Okay, thank you. Those were my questions. Thank you.
Okay, sure. Hi, Jim. Welcome.
Morning.
Okay,
Thanks for coming in today, Jim.
Yeah, thanks.
So we're going to go back to Philip. Philip had a question where a client applied for benefits in 2022 and has not received benefits yet. So go ahead, Philip. Do you have any details you can provide Jim?
So this case is a spousal boost. The husband's already turned on the benefit. So the wife is supposed to, get half of the benefit for the spousal boost. But the wife applied in 2022 for the benefit, and she received nothing. And the person who took care of her retired. So her case was being, open because nobody took care of that. But all in a sudden, earlier this year, she started receiving the benefit from the Social Security office. So I was wondering whether she is still eligible for any benefit in 2023, because that was, pay nothing for 2023.
Yeah, I mean, if depends on when the other benefits started, but she should be due benefits back to when she originally filed. So they have to make a decision on that one way or another. I don't know. You can't just walk in the office anymore. So I'd make an appointment to go in to find out about those benefits, ask to speak to a supervisor or a manager, and ask them to get it straightened out for them.
Oh, okay. Okay. So before we doing that, do we have any forms to file before we visit the office, or we can just make an appointment?
No, there's really no forms to fill out.
Oh,
They until they make a decision, and so they need to explain why benefits were not paid if they're not due, explain why they're not, and then she might have some action after that. But at this point, no, she just needs to go in and find out what's going on.
okay. Okay. All right. Thank you.
Jim, talk about the changes made at SSA in terms of in-office visits.
Yeah, used to you could just walk in and speak to somebody. They're going to all appointments for everything now. Try to, I guess, control the flow into the office. But so you have to call, make an appointment if you want to go in. And there's a couple of issues. I've had one person tell me one of the local offices here keeps saying, "Oh, we don't have any appointments until this coming spring." So that sounds nutty to me. I'm not sure how that's possible. And then another person called for an appointment, and they said they don't have anything right now. They'll send her a letter in a couple of weeks and tell her when her appointment's going to be. So it's a real mess.
And that rule is procedure is effective on January 6th. However, some offices are providing for that to happen now. So
Yeah, some have already gone to it.
yeah. So technically, Jim is saying you need to schedule an appointment. And believe me, Jim, it'd be a lot easier if you can schedule it online. And then there's another change going on whereby they have this callback feature. So the callback feature basically says you give them a call and they will let you know that if you want SSA to call you back when it's your turn, they will call you back. Now, a recent blog I read indicated that the average wait time is about 25 minutes if you call. And they're trying their goal for, I think their goal for 2025 is to cut that in half. Jim, what are the folks saying in your Facebook group about what we just talked about?
They're not really saying a whole lot about it. They're all talking about the change for WEP and GPO. Seems to be about the only discussions here of late. Haven't really seen anything about those changes.
Okay, well, I'm sure you'll hear something or read something from your Facebook group fairly soon on that. Thank you, Jim.
Hopefully.
Okay, we'll go to Carrie as you're drinking some whiskey there. Go ahead, Carrie.
Are you talking to me? Sorry.
No, not you, Carrie. Sorry, we're going to the other Carrie, Carrie, Fenton.
Perfect. Thank you.
Carrie Fenton, anything you want to say? Okay, we'll go to Kathy. Hello, Kath. Okay. Hello, Kathy. Kathy, you're on mute. Here you
Yeah,
go.
I know. There was something in my way. So this
Okay.
is this is a basic question. So I have a couple.
Yeah.
The husband is retired and 63 and not working or collecting Social Security. The ex-wife, and they're divorced and they meet all the tests. All right. They're both unmarried, they're divorced, and they were married over 10 years. So the husband is 63, retired, not working, not collecting Social Security. The ex-wife is still working. So can he start collecting, or he has to wait, she has to collect before he can start collecting on the divorced spousal benefit?
Well, you didn't tell us how long divorced.
Yeah, a long time, 10, 15,
Oh.
10 years.
Okay, Jim, go ahead. I'll let you answer now that we have that last bit of information.
Yep.
Yeah, that's independently entitled divorced spouse area. So from that perspective, he can file because she's past 62 and he's past 62. Of course, if he's eligible on his own, he has to take that first.
Yeah,
You
she's a
can't
higher
just
earner. She's a higher earner, though. She's way higher earner.
Okay, so he would have to go ahead and apply, but yeah, he can do that. She doesn't have to be receiving. She just
Okay.
has to be 62.
Okay. All right. Thank you.
Of course, his benefit will be reduced if he's
Right.
under-
He's got to,
okay.
yeah, he's got to call the shot on whether he wants to wait a little bit longer.
Okay.
Yep.
Okay, thanks.
Thank
Okay.
you.
Aaron, you're next, Aaron.
Nothing today, Mark. Thank
Okay,
you.
thanks, Aaron. Kate, you're next, Kate.
Hey, Mark, how's it going?
Everything's good here. Thanks for joining us.
Thank you for having me. I just have a quick question. Well, maybe it's not so quick. So I have a woman. She just reached her full retirement age in September. She's got kind of a complex situation because her ex-husband has been ordered to pay for her health insurance in the divorce, and up until now, he's been paying her Part B premiums, and she's getting ready to take her Social Security. So she wants to do that, I guess sometime in December, and get it retroactive back to September so that she can get those payments. And she's wondering what happens with the overpayment, because obviously they're going to take out the Medicare payments from her retro benefits, right? And an overpayment will be applied, but she's just wants to make sure that there's no way that the overpayments are going to be applied back to the account that paid them, which is her ex-husband. And also another reason that she's waiting until December to file is because she had some IRMA, due up until November 22nd. That's the last IRMA payment. And then from there, it's going to be reduced to the standard premium for Medicare. I think that's it.
Okay, so first of all, any overpayment will be sent to wherever her Social Security check goes. So she'll get that, he won't.
Okay.
The other part is, at this point, they should take that into consideration and not take out the Medicare for all of that. So
Okay.
there may not even end up being an overpayment.
Okay.
But if there is, it'll come to her.
Okay. And then as far as like the earnings limit, so she does make about $60,000 per year, but up until September, she only made like 41,000. So she'll be good there for the earnings limit.
Well, starting in September, there is no earnings limit.
Oh, okay.
Yeah, she's full
Yeah, so
retirement age, you
because she's
said.
full
So
retirement age, so
yeah,
what she made prior to that doesn't
doesn't
matter.
matter.
Okay, perfect. That's it.
Great.
Thank you,
Thank you.
Kate. Appreciate it. David, you're next, David.
I'm good today, thanks.
Okay, thank you. Josh.
I'm good
Sorry,
today also.
sorry about that.
Thanks.
I was on. What's Josh?
Oh, I'm sorry, the Josh Horton.
I'm good today, Mark, thanks.
Okay, thanks, Josh. Elisa, you're next, Elisa.
Hi, I have two questions.
Okay.
I'm going to piggyback on Sue's question. You said that when a spouse becomes eligible for spousal boost, they have to apply for it. What if when the person's filling out their application, there's a question that says, who else qualifies to collect benefits off your record? What if they put their spouse's name and social security number in there? Will Social Security automatically give the lower earning spouse their spousal boost?
No, they still have to apply.
Oh, really?
Yes. Jim,
Okay.
why don't you add to that, Jim?
Yeah, though, what they'll do is send them a letter that says you may be eligible for additional spousal benefits. Give us a call, and then they'll have to call and take the application. If she ignores it and waits a year, 2 years, and goes in for anything else, they'll say, nope, you had to take this effective way back and give her all the back pay. So, but she does have to file.
Okay. And then my second question was, I have a widow who is 55, and we were wondering if she gets the COLA increases on her survivor benefit since she's not allowed to collect it for another 5 years.
Yeah, what they'll do is they'll compute the survivor benefit based on the year her husband passed. And then every year after that, whatever cost of living adjustments were, they will add to that.
They will.
So why you don't get it on your own retirement, it does apply to the survivor benefit.
Okay. Thank you.
Thank you, Lisa. Appreciate it. Jim, can you file for that spouse boost online? Do you know for sure yet?
Haven't done it, so I can't tell you for sure. Rumor says you can.
Okay, great. Thank you, Jim. All right. I'm going to go to Carrie Schweitzer now. Hi, Carrie.
Hi, I'm just listening in today.
Oh,
Thank
okay.
you.
Thank you. Nadine, you're next. Okay. Oh, okay.
Sorry, I was just listening in to see what the changes were.
Okay, got it. Okay, thank you. We'll have the new guys on a future webinar, but I don't really want to talk. We spent a lot of time a few days ago talking about that, so I don't want to do it now. If you would like a copy of a webinar that I record, the recorded webinar, send me an email and I'll send it to you. Okay, John, you're next, John.
Good morning.
Hi, howdy.
Hey, sad to see you guys go, but hopefully it's for the better. I don't think that's going to happen, but oh well.
Yeah, it'll
Anyway,
be fine. But it's
okay.
time. It's time.
Okay.
Go ahead.
Well, very good. I am just trying to figure out these. I have somebody who filed early or filed their what do you call it? Their benefits at 62. His income's going to be way higher, like $70,000-$80,000. And I want to know, I know we talked about this last time we were on. He can go back up to 1 year and pay back everything. What is the procedure to do that if he wants to retro his payments? Because he's really going to lose everything he's earning, correct?
Well, he'll lose whatever he paid in, or whatever they paid him in benefits if he withdraws. And if he doesn't do anything with those kind of earnings, then he won't be paid anything anyway. And when he eventually reaches full retirement age, they'll call those credit months and adjust his benefit, and he'll get the full amount. But if it's been less than a year, he can withdraw, and whatever they paid him, he'll have to pay back.
Gotcha. And the process is just, is there a form?
Yeah, it's an SSA 521.
SSA 521, okay.
And you can get that online. If you just Google SSA 521, it'll give you access to it. If you go to ssa.gov, if you scroll all the way down to the bottom, there's a link for forms, and you can click on that. That's the official Social Security, because sometimes there's other ways, other places that have the forms that want to charge you. But go to ssa.gov, go to forms, and type in 521 and it'll give you the app.
Is that something that can be paid back over time, or is it a one lump sum payment?
Used to be lump sum, but they will allow you to pay it over time. They won't complete the processing of it. What'll happen is when he files a 521, they'll suspend his payments so he doesn't get any more money, and then he can pay it back over time. And as soon as it's paid back, they will complete the withdrawal.
Okay, but everything stops at that point. There's no okay, so he's not.
Yeah, they won't pay him any additional benefits. They suspend his payments.
Is there like a maximum time frame that they will allow him to pay it back, like a year?
I'm not sure. I haven't run into it. They didn't use it. It's fairly new that they let you pay it back in installments. So I'm not sure what the actual rules are. I couldn't find anything on it.
Gotcha. All right. Thank you.
Sure.
Thanks, John. Okay. Mike Moss, I'm going to go to you next.
Yes. If you hold off on your benefits past age 62 to like 67 or 70, at what age do you start getting the COLA on unclaimed your own benefit?
At age 62. That's when
Okay,
COLA
so
begins.
up until then, you get the wage adjustment, correct?
What do you mean by the wage adjustment?
Well, there's an increase according to the wage adjustment, the average wage in the country. I remember back during COVID,
the indexing factors begin at age 62 for somebody. So,
but that's for the COLA, right?
No, it's different. No, the COLA is 2.5%, and the indexing factors are different. It's so what we take your earnings by year and multiply that by an indexing factor, come up with the indexed earnings, and the indexing factors will apply through age 59. So, but they begin they're known for you when you turn age 62.
Okay, so if the client holds off from age 62 to 67, he's getting the COLA between those years, correct?
Yeah. Mm-hmm.
Okay, I thought so. I just wanted to double check, make sure. Thank you.
Yeah. Okay. Thank you. Karen, you're next, Karen. There you go.
I'm just here to listen. Thank you.
You're welcome. Thank you. Darlene, you're up, Darlene.
Good morning. I do not have any questions today. Thank you.
Thank you, Darlene. Go to Faye. Hi, Faye. Okay. Next to Faye is federal retirement. I believe that's another Josh.
Yeah, it's Josh Silverman. I don't have anything other than how badly you think Ohio State's going to beat Michigan this week.
No idea.
Depends on if I watch. When I watch, they lose. So
exactly.
They should pay me not to watch.
Thank you, Josh. Ethan, you're next, Ethan.
No questions this morning, guys. Thanks.
Okay. Hi, Julie. You're next, Julie. Okay, go to Mike. Hello, Mike. Mike Decker, you're next. Okay. Alicia. Hello, Alicia.
Hi, so I had a clarifying question. I was on the phone with a client who is self-employed, and she was trying to figure out the earnings test. And in my discussion, I was trying to tell her about, the wages that were earned, but she was saying that for self-employed individuals, it's how much they work, not how much they earn. And I just wanted to clarify that and see if she was correct, if her understanding was incorrect, because I was trying to look through the book too, and it was saying something about like substantial stuff for self-employed individuals, but I wasn't understanding it.
Yeah, they can look. Well, first they'll look at the amount. So it depends on what her net profit is. And if it's under the amount, they don't care. If you go over, and they will look at they don't often do this, but they can look at the hours worked. If you work over 45 hours a month, then they can apply a value to it, uh, and uh, and use that for the earnings test. If it's a highly specified profession like a lawyer or a doctor, they go by 15 hours a month. So they can go by the hours you work, yes. But if you end up under the limit, it doesn't matter anyway.
Okay, thank you.
Jim, are they really going to do that? Are they going to take the time?
They don't hardly do that anymore.
Okay.
Only if you tick somebody off.
Okay. Thank you, Jim. I never do that.
Yeah.
Okay. Let's go to I think Mark's next. Mark T.
Nothing for me. Thanks, Mark.
Okay. Angela. You're up, Angela. Boy, that was quick. Jim, let's go ahead and award our gift cards. Go for it, Jim. 2 gift cards, please.
Well, what numbers are we looking at?
Oh, good point. 1 to 27.
Let's see. That would be 9 and 15.
Okay, let's see what we have here. Kate, and your daughter, you win a $50 Amazon gift card. Okay, send me an email, Kate, please. Carrie Schweitzer, you also will win a gift card. So both of you, please send me an email, and I will have Aaron send you each a $50 Amazon gift card.
Thank you.
Oh, pleasure. Thanks for being here. So, Jim, let's talk about some more recent questions we've received over the past couple of days or couple of weeks. What's the last 1 or 2 questions you've answered lately?
Well, I've had one person trying to get a hold of the Social Security office to file for some benefits, and she was on hold for 3 hours and never got to talk to anybody. So that's been a tough one.
I thought it was only
sure what
20
to tell her to do since you can't go in anymore.
Jim, I thought it was 25 minutes.
Yeah, that's what they like to say.
Going down to 13. That's amazing.
And there's a good question in the chat from Kathy. You guys can read it.
Okay, yeah. Okay, we'll get there. Okay. Jim, okay, so what was the next question maybe you've received? 3 hours though on the phone.
Yeah.
Should that person contact their congressperson's office?
Well, that's what I haven't replied back to her yet, but that's what I'm going to tell her.
Okay.
Yeah. And so, one other question was, we had somebody who their spouse passed away. They had a young child, and the people never filed for benefits, and now the child's aged out, and they were wondering if they could go back and get those benefits. And unfortunately, no. The only time there might be an opportunity to do that is if Social Security gave them misinformation, and I can't imagine that happened in this type of case. So unfortunately, those are benefits that were lost.
That's too bad, definitely. Okay, so I do know we have something in the chat, so let's go ahead and go there too. All right. Kathy's asking, what is the maximum amount or percentage a person's Social Security benefit can be garnished for debts?
For garnishment, it depends. It can be up to 50%. They can take half of the benefit, unless there's back payments due. So if you owe back child support or back alimony, they can take up to 55%.
Thank you.
Jim, did the garnishment rules change? Have they been that way for a while?
They've been that way as long as I know.
Okay. And going back quite a ways.
Yeah.
Jim, let's talk about surviving spouses. I know that's always an issue that people, those questions come up all the time. But there was another question that came up recently. Somebody owed, I think, $36,000 back to the Social Security Administration. And I knew immediately what it was when this advisor sent me an email. It was for overpayment relating to WEP and or GPL. So this person is a government employee and either did not tell Social Security that they were receiving a pension from work not covered by Social Security, or did tell Social Security that, but Social Security did not adjust for that, or I guess there could be some other reasons too. But eventually, Social Security sent them a letter. They owe about $36,000. Jim, what can be done in that situation?
Well, they can pay it back. If they don't think it's right, they can file a reconsideration and just say why they don't think the facts are correct. And if they have any proof, they can provide it at that time. If the reconsideration is denied, then you file for a hearing before an administrative law judge. You can also request monthly installments. If you're getting a benefit, the commissioner, the most recent commissioner, limited withholding from somebody's benefit up to 10%. Used to, they could withhold 100%. They would just withhold your whole check till the was recovered. Now you can have it limited to 10%, or you can set up a payment plan. Even if you're not getting benefits, you can still set up a payment plan. They like to recover it within 3 years if they can, but you can take longer. If the overpayment was not your fault and you can't afford to pay it back, you can file a waiver. You have to meet both conditions. They will make the decision, are you without fault first? And then if you are you financially unable to repay the overpayment? They're going to look at all the income and expenses in your household. So it's not just your income, but your spouse's income or anybody else that lives in your house. And what do your bills look like? So those are your options.
So in order to have it waived, it cannot be your fault for it, and you don't have the resources to pay it back. So 9 times out of 10, these folks will have the resources to pay it back. Unfortunately, they got the money. And so it's very unusual that Social Security will waive that type of overpayment. But Jim, we get that situation frequently during the year, right?
Yeah, we get that fairly often. It does happen. You know, they ask during the application process if you ever work for a job where you didn't pay Social Security tax. If you say yes, are you receiving a pension? And if you say no, they want to know when you think you might receive it, and then they're supposed to follow up. Whether they follow up timely or not, it's hard to say, but there are also reporting instructions at the end of the application that says one of those would be, if you receive this non-covered pension, you should report it to Social Security. So it's hard to show without fault.
Yeah, it definitely is. All right, so let's talk about surviving spouses. Earliest age they can collect is what age, Jim?
Age 60 unless disabled, and then age 50.
That's disabled 7 years prior to the death of your spouse, or and also 7 years after the death, right? So it's 14 years.
Well, it's just within 7 years of their death. If you were disabled, if you've been disabled all your life and your spouse dies, then you could draw as a disabled widow or widower.
Got it. So, Jim, under what situations do you have to be married to the deceased for at least 9 months? Under what situations can that 9-month rule be waived?
The big ones, they were in the military service and died in the line of duty, or they were in good health, had a life expectancy of 9 months or longer, and died as a result of an accident.
So those two situations, you can have that 9-month rule waived and be eligible for a surviving spouse benefit. Perfect.
Yeah, what they're trying to avoid is somebody getting married on their deathbed so that that person can draw benefits off of their work record.
Okay. And there's really a provision that does not apply to surviving spouses, Jim, which gives them additional options, right?
Not sure what you're talking about.
Deemed filing.
Oh, yeah, deemed filing doesn't apply. So you do have the ability. They still call it a restricted application. That's the one time it's still a viable option where you just say, I want to restrict my application to widow's benefits or retirement benefits, and then file for the other benefit later.
Got it. So deemed filing, it's not a friend of yours. And if you could avoid deemed filing, like in a surviving spouse situation, that's great. I'll talk about that benefit matrix document to request from SSA.
Yeah, you get that from the local office. I mean, technically, you could get it from the 800 number, but good luck with that. The benefit matrix will just show your benefits for your own retirement. Starts at 62, runs through age 70, and shows what the amount would be if you start at any specific month. 62 in 1 month, 2 months, 3 months, all the way up to 70. Now, the nice thing about it, this is based off of Social Security records. So the benefit amount is going to be your benefit amount. It's going to be a correct amount. You can also get the benefit matrix for survivor benefits starting at age 60 up until your full retirement age. And it will give you the amounts at specific points of time. And so you can get them both on the same record if you're eligible for both. And that way it's easy to compare. If I start my survivor at 60 and my own at 70, what are the benefit amounts? Or my own at full retirement age, or my own at 62 and the survivor at full retirement age. So you got all kinds of combinations to look at.
Jim, what if you have two deceased spouses out there? Do you need two benefit matrix reports?
Yeah, you'd need two.
Okay.
Because each record's separate from the other.
And okay, so each one will show what you can get off of one of the deceased spouses along with your own benefit amounts.
Yeah.
And why did you say that? Why did you say that getting a benefit matrix report from the 800 number is not might not happen?
The odds are they don't know about it. No, they won't know what you're talking about.
Interesting. Okay. All right. So you would need to schedule an appointment then to go to, it's really too bad. Need to schedule an appointment then to go down to the local office. Jim, what other questions have you had recently?
Had some questions about Medicare.
Irma.
Well, there's always Irma questions that I always avoid because I don't know that much about Irma. I do know that if you have a life-changing event, you can request that they use your current income. But once we get beyond that, it's a little tough. Medicare, about who's eligible and when, and where you have to be careful. If you have someone, let's just say they're covered through their employer group health plan, and you can, once you're 65, you can switch to Medicare whenever you want. You have a special enrollment period, and we talk about that being an 8-month window that begins the month your work insurance ends. So when you retire, you have 8 months under the special enrollment period to file for Medicare, and there would be no penalty. But technically, even while you're working, if you decide Medicare would be better than your employer insurance, you can switch to Medicare and you're not penalized because you're past age 65. Where you had to be careful if your employer insurance also covers your spouse and maybe kids, and you stop your work insurance to go on Medicare. Now, what are they going to do? They're going to have to go out on the open market and purchase Medicare. So it may still be better, while sometimes Medicare and a supplement's better than your work insurance, it's still dependent upon who else might be on your plan. So Medicare is important. Also with Medicare, I had a question about children and when they would become eligible. If you have a disabled child that's going to be eligible for a benefit off of their parents' work record, they will also become eligible for Medicare. They have a 2-year, 24-month period they have to wait, and it begins at age 18, and that 2-year period doesn't begin before. So basically, at age 20, they can go on Medicare. And can they go on before that? No. If they're not disabled, can they go on Medicare? No. Pretty much it's specific either to someone age 65 or older, or someone disabled 24 months or longer.
Yeah, I had to change my Medicare prescription drug plan this year because one of my medications was not being covered by the company I had been using, which is WellCare. And, WellCare wasn't going to charge me a premium, but when my drugs came off for their formulary. And so I switched to Cigna. Cigna covers all my prescriptions. And also, so I switched to them. Plus, the agent that I use, he doesn't do any Cigna stuff. But he did help me sign up for Cigna. But yeah, interesting. This is the first year I had to change from one prescription drug company to another. Interesting. Jim, did you have to change?
No, because my prescriptions through my Blue Cross Blue Shield through the federal government, through my employment there, it carried over into retirement. So that's my Part D plan. It's through my former employer health plan.
Got it. Thank you. Jim, there's a question when you apply for benefits now that they ask you about, in case you're not able to handle your own affairs, do you want to assign somebody, a representative? Is that the case? Is that on the application now?
It's the very last question before you get to the outline of your questions, a review of your questions. And that's just to tell Social Security who you would prefer manage your funds should you become unable to manage those. So for instance, someone has dementia, we know they're eventually going to reach the point where they're not able to manage their own funds. And so who's going to do that for them? Well, regardless of what you answer that question, somebody's going to have to file to be the representative payee. But if you indicate on your application when you file who you would prefer, it tells Social Security, yeah, when I did have my faculties, I preferred that my spouse manage my benefits. So doesn't mean Social Security has to follow that. They're still going to look into that person. One of the questions they ask you ever been convicted of a felony? It's not guaranteed that it knocks you out of contention, but it sure is a big red flag. So depends on the circumstances, I guess. But you can answer it yes and put down your spouse, your kids, a friend, whoever you want to put, or you can say no. Either way, it doesn't matter. They still have to file the representative payee application.
But if you do put somebody down there, you still might have to file that form, right?
Oh, they absolutely have to.
They still have to. So, you got to file the form anyway. So I'm not sure what the benefit is.
It just lets them know that was your, who you preferred, and if there's no reason not to, then that's who Social Security would pick.
Got it. Okay, thank you, Jim. Mark, I didn't get to you. Do you have any questions you'd like to ask? Mark Tarwater? There you go.
No, I'm good. Thank you.
Okay, I know you came in a little later. That's fine. Jim, let's talk about divorced spouses a bit. First of all, can you estimate what color would be for next year? What's your best guess?
Well, if I had to guess right now, I'd say 2.7%. That's what the CPIW was for November.
Okay.
Hard to say.
Gas here in Cincinnati, I saw as low as $2.65 a gallon recently. So There was one gas station at $2.65, another one at $3.
Well, let's see. Which one did you get gas at? The
I
$3?
did need gas. And by the time I do need it, folks, it will be back. There won't be any less than 3, I'm sure. Okay. Does anybody have any additional questions you'd like to ask us? We only have 5 minutes to go. So do you want a discussion? What would you like us to talk about? Tell us 1 or 2 ideas.
Yeah, this is Sue. Can you hear me?
Uh-huh.
Thank you. I have a client that's he's a veteran, and all of a sudden the veterans were not going to cover him for non-Hodgkin's lymphoma that he received during the Vietnam War. So now it's the cost of that treatment each month is $4,000 because he took not a supplemental to Medicare B, but an Advantage. He has to pay 20%. So he has an appointment December the 3rd, I believe. I know the open window is about to the 7th or the 8th. So when he's visiting with Medicare or with a Shine, official, can they sign him up right away for Medicare B, and then he goes and help him with the supplemental, signing him up immediately? Do you think?
So he doesn't have B at the moment?
No, what they did, they talked him into Medicare A and an Advantage program.
Well, if you have Advantage, he's got B. You have to have A and B to have the Advantage plan.
Excuse me, it's B, but he's out on the limb for the 20% for some reason.
So the problem is, he can go and apply for a supplement plan, but because he's past his 6-month window with his initial enrollment, they're going to underwrite it. And they're going to ask him some questions, and they may refuse to cover him. It's possible they'll cover him and say, well, your premium's this amount, but odds are they're just going to say, sorry, we're not going to cover you. Is there another Part C plan that might be better? That's something that I guess the person he's going to talk to will discuss with him, because you can move around from a Part C plan to a Part C plan without the underwriting. You just can't go from Medicare Advantage to a supplement once you're outside your 6-month window without them doing an underwriting procedure. So yeah, he might be kind of stuck.
Yeah.
I'm not sure why VA wouldn't cover it, but he might want to visit his congressman too and have them look into it.
Yeah, I already hooked him up with the White House and the ranking member of the Veterans Affairs, as well as Senator Warren. Okay, and they're trying to help him out. So in other words, even though he's been with Medicare for a number of years, he's in this quandary right now. Then.
Yeah, he's kind of that's the one issue with the Medicare Advantage, is that you can't just go to a supplement plan if your circumstances change. You can go from a supplement to Medicare Advantage pretty easily, and you can go within the Medicare Advantage plans pretty easy, but you can't go back to the supplement plans without it being underwritten.
Okay, so I was fortunate. I trusted my intuition, and it told me to, go with the full boat of A and B plus a supplemental, no copay, no deductible. And darn it all, my intuition was right.
Yeah, because eventually you
get older.
You get older and you need more stuff.
Yeah, 1 month my bill was $18,000, still didn't have to pay a penny, and for about over 3 years, every month was $4,500, not a penny or anything.
That's nice. You made the right decision.
Choose wisely, and like in the Raiders of the Lost Ark.
Yeah.
All right. You're welcome. Folks, it's close enough to 11 o'clock. Jim and I want to wish you all a happy Thanksgiving. Don't eat too much. Lay off that stuffing. Lots of carbs there. And we'll be back in touch with you in a couple weeks for another open forum. Bye, everybody.
Goodbye.